Hello everyone, welcome back to Jacob's Academy. So today we are starting osteology, which is a study of bones. On the screen you can see the human skeleton, which forms the framework of our body. And the osteology mainly focus on understanding the names, position and importance of these bones. So coming to head and neck region, starting from the top, this is the skull, also called the cranium, which protects the brain. And below the skull, we have the mandible or lower jaw bone. And the bones of the neck are called cervical vertebrae, which support the head and allow neck movements. So we can see next vertebral column, and the backbone or vertebral column is divided into regions. First region is cervical vertebrae, which means in the neck. Thoracic vertebrae in the chest region. Lumbar vertebrae in the lower back. Sacrum at the lower end. So these bones protect the spinal cord and support the body. So when we are coming to the thoracic cage, in the chest region we have the sternum, ribs and thoracic vertebrae. So together they form the thoracic cage, and which protects vital organs like the heart and lungs. So when we can see the upper limb bones, which means moving to the upper limbs. As we can see clavicle, scapula, humerus, radius and ulna, carpals, metacarpals. So these bones help in movement and daily activities. So coming to the pelvic, in the middle we can see the pelvic, so which connect the trunk to the lower limbs and supports body weight. So when coming to the lower limb bones, in the lower limbs we can see femur, patella, tibia and fibula. So these bones helps in standing, walking and balance. So for the exam, you should remember total number of bones, longest bones and the study of bones. So this diagram is very important for labeling questions. So we can see the topic clearly on the next slide. We can go. In this session on osteology, we will cover the introduction and definition, followed by the functions of bones, their classification and structure. We will also discuss bone marrow, the clinical importance for nurses, and the end with a short summary. So let's begin our class. So next we can see the introduction. Osteology is the branch of anatomy that deals with the study of bones. The human skeletal system is made up of 206 bones which provide shape, support, protection and movement to the body. So this basic concept is very important for anatomy exams and nursing practice. So next we can see the definition. Osteology is the branch of anatomy that deals with the study of bones. So next, what is osteology? So in the simple word, we can see osteology means studying the bones of the human body. Bones together form the skeletal system. Here points you can see osteology is the study of bones from the skeletal system. And the third one is human body has 206 bones. Last point is bones give shape, support and protection. So in the human body has 206 bones, and these bones give shape, support and protection to the body. So this definition is very important for exams. So remember it clearly. Next we can see functions of bones. So bones perform several important functions in the human body. First function is support. Bones from the framework of the body. So the second one is protection, which means bones protect vital organs like the brain, heart and lungs. So the third one, movement, means bone act as levers for muscles helping in body movements. So the fourth one, blood cell formation, means the blood cells are formed in the bone marrow. And finally, mineral storage, means bones store important minerals like calcium and phosphorus. So these functions are very important for exam. So remember all the 5 points. So coming to classification of bones. Bones on the shape. Bones are classified into 5 types. First, long bones such as femur and humerus. These help in movement and support. Second, short bones like the carpals and tarsals, which provide strength and stability. The third one, flat bones, which includes skull, ribs and sternum, and which mainly protect vital organs. So coming to the fourth one, irregular bones such as vertebrae, which have complex shapes. And finally, sesamoid bones like the patella, which are embedded in tendons. So this classification is very important for exam. So please remember with the example for each type. So here some diagrams are there for your reference. You can see here. So next we can see structure of a long bone. A long bone has a specific structure with different parts. So here we can see one by one the diaphysis, which means it's a shaft of the bone. Coming to epiphysis, which forms the ends of the bone. Between them is the metaphysis, which is the growth area of the bone. And the outer hard layer is called compact bone, which provides strength. The inner part is the spongy bone. So inside the bone is the bone marrow, which may be red or yellow. So this structure is very important for diagram, labeling and for the exam purpose. So see the structure of the bone here by labeling each parts. So coming to bone marrow. Bone marrow is a soft tissue present inside bones. So there are 2 types of bone marrow. First one is red bone marrow, which produce red blood cells, which means RBC, and WBC means white blood cells, and one more platelets. So red marrow is very important for hematopoiesis, which means blood cell formation. The second one is yellow bone marrow, which means mainly stores fat. So this topic is commonly asked in exams, especially like the functions of red marrow. Such kinds of question maybe they will ask. So next we can see clinical importance for nurses. The first one is helps in fracture care. So the nurses need to understand basic bone anatomy and fracture types to recognize signs like what? Deformity, swelling and also loss of functions. Then only we can do report to the doctor regarding the patient condition. So the second point is important for orthopaedic assessment. So in orthopedic wards and emergency units, nurse perform or focused musculoskeletal assessment, like we are including inspection, palpation, range of motion and neurovascular check. In neurovascular check, what are the things we are doing? Pain, pallor, pulse, paresthesia, paralysis. So a strong understanding of bones and joints, it will help the nurse to detect abnormal findings early. And also we can do communicate effectively with our medical team. For what? For doing timely interventions to the patients. And the third one is understanding bone disease. For example, osteoporosis. So we all know osteoporosis is a common bone disease that weakens bones and it will increase the risk of fracture. So especially we can see osteoporosis in older adult. So the nurses plays a key role in identify at risk of patients, and we are doing educating them regarding the diet, exercise, medications, and also we are doing fall prevention and promoting them to the treatment plans. So the fourth point is assist in X-ray interpretation. So in that one, while nurses do not formally read radiographs, you all know that one, and knowingly normal bone structure and common fracture pattern, which will help them thoroughly understand X-ray reports and anticipate required care. So coming to the last point, essential for patient mobility care. So this knowledge means the skeletal and muscular system, which will help the nurses to plan safe positioning, turning, and ambulation, reducing the risk of falls and further injury. So nurse also teach patients how to use the devices and encourage early but also safe mobilization and to prevent complications of immobility like such as pressure sore, pressure injury, deep vein thrombosis. So we all need to know regarding the clinical importance thoroughly. Now we can summarize the topic. So we now know regarding osteology, which means the study of bones, including their structure, development, and disease. So bones have several important functions. They support the body, protect vital organs, enable movement with muscles, store minerals like calcium and phosphorus. And we also learn regarding the types and structure of bones such as long, short, flat, irregular, and also nurses focusing the clinical relevance. So these all are the topics we already covered in the session. Thank you so much for spending your time with Jacobs Academy of Nursing today. I really appreciate your time and interest to study with the Jacobs Academy. Anyway, if you found this session helpful, please like the video, share it with your friends, and subscribe Jacobs Academy so you will never miss the upcoming session. So see you in the next class. Bye.